Hi everybody, welcome to Dr. Harry's Healthy Corner. Last week we talked a little bit about types of hair loss, and this week I wanted to talk about solutions. If we're experiencing hair damage and hair loss, are there some solutions that we can start incorporating right now that can help to reverse some of that hair loss or damage or prevent it from being damaging any further? And if so, what are those things? Well, let me refresh some of what we talked about last week. We talked about it being important to know what type of hair loss that you're experiencing, and we talked about the different types of hair loss, from traction alopecia, which means when you put too much traction on the hair, you can experience loss in those areas where the traction is primarily concentrated. We also talked about the autoimmune type of hair loss. We talked about hair loss that happens with hormonal changes and aging, and the hormonal type of hair loss. We also mentioned that certain medications and diseases can contribute to hair loss, such as hypothyroidism can contribute to hair loss. We talked about the hair loss that's associated with medications and with treatments such as chemotherapy. But this week, what we wanted to focus on were some solutions. So the first thing I wanted to say is that your daily hair care is very important. What we put on our hair and how much we blow dry our hair or flat iron our hair or do numerous procedures to our hair is important, because the hair is in the follicle, and follicles can be relatively delicate if they're subjected to repetitive trauma over and over again. So apart from traction alopecia, and that involves, of course, pulling the hair back very tightly, or can even involve if you have hair extensions as well, that can place undue traction onto the hair follicles, causing the hair to fall out prematurely. So last week we mentioned the different phases of hair growth, and we mentioned that the growth phase, the anagen phase, is the phase where the growth happens and can last for years, sometimes up to 7 years or so. The hair cycles and most of the hair is in the growth phase normally. There are some things that can trigger the follicles to prematurely enter into the phase where the hair falls out. Those are the things that we need to be very cautious about. Those things involve yo-yo dieting that we mentioned before, because we may experience nutrient deficiencies. Iron deficiency has been known as a source for premature hair loss. So if you're experiencing hair loss, one of the things you might want to have checked are your iron levels and your ferritin levels. Ferritin levels below 40 is thought to be associated and increasing our risk of premature hair loss. We talked about traumatic hair loss, such as what happens in major illnesses. If that occurs, the good news is that hair loss is usually temporary, will probably show up about a month or two after the major trauma has happened, because again of the hair cycle, and hair growth is usually the natural thing that occurs after that. However, at this point, you may want to make sure that your nutrients and your diet is very sound, because the hair needs nutrients to grow. The hair consists of protein and certain fats, and it does need those in order to grow well. Certain minerals have been associated with an increased risk of hair loss if used excessively. Minerals like selenium, which we know and we've heard about, have been associated with improving thyroid health in excess, can actually contribute to hair loss. Excessive zinc and excessive vitamin A as well has been known to contribute to excessive hair loss. So those are things that you would like to pay attention to. Look at your vitamin or your medicine cabinet, take stock of that. Just take them to your physician, have a discussion about things that could potentially be causing your premature hair loss. As we age, our hormonal balance, our hormones become imbalanced, and that can contribute to hair loss as well. And that is usually the most common form of hair loss as we get older. Now, some treatments for that may be replenishing our hormonal levels if you are a good candidate. It is important to discuss with your physician if hormones are right for you. Some people who may be excluded from hormones are people who have strong family history of hormonal cancers such as breast cancer or prostate cancer, and people, of course, who have been diagnosed with cancer, with hormonal cancers themselves, would be excluded. If you have a history of a clotting disorder, you may also not be a good candidate for hormonal replacement therapy. Other new treatments on the horizon for such kind of loss, we've heard about stem cell injections. Well, these injections are often done by taking your blood and extracting the platelets that are thought to contribute to the growth of the hair. And that is then injected in those areas of concern. Speak with your dermatologist or your physician about that possible procedure. There are some studies that say that are positive with this, and there's some studies that showed neutral or no change. But if you've experienced improvement from that treatment, then of course it works for you. Other things that you would consider is that your dermatologist or physician would discuss this with you if you're suffering from autoimmune conditions such as alopecia areata. You may benefit from steroid injections into that area. If your hair loss is caused by inflammation, infection, then your dermatologist may suggest a different treatment. Also, things that have been known to help are ketoconazole, which is an antifungal ingredient that's found in shampoos such as Nizoral. There is over-the-counter, and then there's a prescription strength that contains a slightly higher percentage of ketoconazole. Now, there's some research that suggests that ketoconazole may also help with hormonal hair loss as well. Discuss this with your dermatologist. So in summary, what I really wanted to say here is nutrients are important. Your nutritional status is important. Excess of certain vitamins, of certain minerals and vitamins can contribute to hair loss, but deficiency of those can contribute to hair loss as well. There are some treatments that are minimally invasive that may help with hair loss. When I experienced my bout with hair loss about 3 years ago, I absolutely paid attention to my nutrition at that point. I absolutely did have my levels measured, and I also opted for some injectable treatments into those areas, and the results were really good. So it's really important that you find out the reason for your hair loss so that you may begin treating it. Now, P.S. side note, if you have experienced alopecia areata or just complete hair loss, whether it's been from chemotherapy, treatment, or autoimmune conditions, please know your hair does not make you who you are. Who you are is somebody deep inside that just really want to express themselves to the fullest ability, and you should be able to do so. So experiment with things. Wear different hair colors, wear wigs, just stand in your truth and stand in who you are. Because honestly, that is the most beautiful thing of all. I have noticed that a woman's beauty, when I notice that a woman is beautiful, I've also noticed that it didn't matter what her hair length was. So I have seen beautiful women with longer hair, beautiful women with shorter hair, beautiful women with no hair. But what I see in them is that beautiful inner beauty that cannot help but to shine through. So if you have any question about this presentation, please, again, forward them to me. Until then, please let your inner beauty shine right on through. Until next time, this has been Dr. Harry from Dr. Harry's Healthy Corner.